Good evening. You are watching Out Here in the Redwoods, and come out wherever you are. We are time zone friendly, so whatever time zone you're in, welcome, and aloha means hello and goodbye. And for Chad Duran, our creator, and everybody here at Out Here in the Redwoods, we welcome you. And today is our second show of our brand new season. Now, if you remember in our first season, our second guest was a man by the name of Heath Lopez, a transgendered man. And we're going to continue this conversation because we have a very interesting guest here today, Heath Russell. Everybody, aloha, give him a great big welcome. Welcome to Out Here in the Redwoods. Nice to meet you, Heath.
Nice to meet you too.
Now, what under the rainbow is going on with you? You are a transgendered man. Is that how? Because am I saying that correctly?
I was, and
Okay.
then I'm detransitioning back to my birth state as a female.
Okay, so you were a girl, transitioned to a man, and now we're going back.
Now we're going back.
Wow.
Yeah.
Wow. So we were talking a little bit briefly, but the viewers at home need to know a little bit more about what's really going on. We found out from Heath, Reese, sorry guys, that this is a very delicate issue.
It is.
And a lot of things can go right and a lot of things can go wrong. So far, what's been going on with you?
That's been going on right or wrong?
A little bit of both.
Okay.
Let's start out from the beginning.
Okay.
What made you decide that you wanted to live your life as a man at that point? Let's start there.
Well, off and on since I was a little kid, I would have these thoughts where, you know, I wouldn't grow up to be a woman, that I would be a boy someday, that, you know, I would get married to a girl and things like that. These thoughts came and went, and I didn't think there was anything available to me until I was about 17. Up until that point, I had only seen or heard about male to females, otherwise known as trans women, who transitioned, but I didn't realize that there was anything available for female to males. And I learned at 17 that there was a word for what I was going through. Being sort of thinking that I was a guy.
What was the word?
The word that I had learned was, it was FTM, transgender, female to male.
Female to male, FTM. Okay.
FTM.
Okay.
And I had sort of gone through a state, the first year I had discovered it, where I was more trying to get people to call me by a new name, trying to get people to call me by he pronouns, he and him pronouns. But I also didn't quite know what I could do from there. So I was involved in therapy for a little bit, where I was talking out my feelings with people, with doctors, and so I started hormones on January 4th, 2010.
See, Heath Lopez says that this is a very difficult time.
Yeah.
And they can go right or go wrong.
Yes.
And once you take those, you can never go back. So you started taking hormones. What's been your experience so far?
Well, I started it in 2011, January 4th, 2011. And so I was, with the exception of about a month there, I was on hormones for almost 2 years. And during this time frame, I got the changes that I expected would happen. I had done about 4 years of researching the effects of hormones, but I clearly didn't do the research well enough.
So what kind of effects were you experiencing as you researched?
Oh, well, I found that, well, as I was on the hormones, the physical changes happened. I got more acne, I got more body hair, I got facial hair.
Okay.
My voice deepened. I had some, what they call downstairs growth.
Okay.
But nothing like too substantial. I've even been getting thinning hair.
Really?
Yeah, it's very similar to what female bodybuilders go through, and nobody likes to acknowledge that, but it's true.
Really?
Yeah.
I didn't know that. Oh, wow.
We are also, FTMs are also we are 25% more likely to develop polycystic ovarian syndrome as a result of long-term synthetic testosterone use, which
Wow.
can only be alleviated if you cease hormone therapy or receive surgeries, either removal of the ovaries or the uterus or both.
Wow.
Yeah, you're at risk for lots of different types of cancers. Once you start testosterone, you're at risk of breast cancer. You're at risk of uterine and ovarian cancer. You're at risk of you're at a higher risk of heart disease. I knew about all of these negative impacts before I started the hormones, but like a naive person, I just assumed, oh, these things will never happen to me.
Right.
Kind of like a person who has unprotected sex. Oh, I'll never get an STD.
Whoops.
And I realized about a year into hormones, I was starting to get heart palpitations, and my blood, my pulse had raised. It had gone through the roof. And someone recently in the community attributed that to me being a person of size, and I had never had these.
What does that mean?
Since we're all people of size, I'm not sure, but
Because I'm a big girl. Am I a girl of size?
I would say.
G-O-S.
I would say it loud, say it proud. I'm fat.
Sweet. Hey. I don't mind. My last meal ain't gonna be oatmeal. I'm sorry. It's gonna be cake.
Yeah, exactly. And I make healthy choices. I do, and I get my exercise, and a lot of these physical problems that I was starting to get on hormones, I had not had previously. So I knew it was related to the hormones, directly related to them.
Where was your doctor in all of this?
I was seeing a doctor. When he gave me the prescription, before he gave me the prescription, he did a blood panel of me to find out how my cholesterol was doing, how my fat levels were doing, my hormone levels, and he gave me a booklet that was about 25 pages long, detailing what I was going to be expecting on hormones, and to sign it at the end to acknowledge that I read it, and anything that I had wrong would be like my own fault, and that's fine.
Wow.
But the funny thing is that he gave me this information, and I already knew this information from years of doing online research about HRT.
So you weren't going blind into any of this?
No, I was going in there making an informed decision, and that is why I feel like it's very important for people to realize that even if you're making an informed decision, you can still make a mistake.
Right.
You can be completely wrong about what you thought was the best thing for you.
Wow. And did anybody hold your hand through any of this?
No.
What about your psychiatrist as you were going through this? Did they kind of help at all?
Nobody ever really wondered or asked me where these feelings were coming from. Because there are people who exist who think that they shouldn't have their legs, that their legs shouldn't exist. This is called phantom limb syndrome.
Right.
They identify as having no legs.
Right.
So it's also called body dysmorphia, where you can't stand certain body parts, or you feel like you're too fat or too ugly or something.
Right.
And there's really a problem with our mental health in this country because we don't address why people get these feelings, where these thoughts come from.
Right, right. And we talked a little bit earlier. What Reese told me was that from the get-go, Reese felt like a boy. And we kind of discussed what are boy feelings, what are girl feelings.
Right. And
they were trying to put you in a mold. So I have to ask you, are you going through a process now? Are you thinking you're gay? Are you a lesbian? Or are you a man looking for a woman? And I think Chaz Bono kind of went through that, and then is now going through what you're going through, because he hasn't completed the process yet, I don't think.
Yeah.
So by what you're saying, I really feel for you. I feel for you.
Yeah. It's interesting because whenever I ask, what is brain sex? Trans people tend to cite a research study involving only 18 test subjects saying that there's a difference in brain matter between female brains and male brains. And I figure, okay, so what you're trying to say is that male brains and female brains are inherently different. This reminds me of a time in history when doctors and scientists were trying to claim that people of color had different skulls than white people.
Yeah.
And only instead of it being a racist concept now, it's a sexist concept now, that there's an inherent difference between the brain of a male and a female.
Right.
And it's pretty regressive when you think about it. So then we start talking about what's it mean to think like a boy or to think like a girl.
Right. Well, he put it in the concept of being in a locker room as a girl himself at a young age and knowing he shouldn't be in there. That's how he thought. So where were you?
Well, I've always kind of struggled with my own body in terms of my breasts. You know, I've always felt, and other parts I've always felt very inadequate. Society teaches us that unless our vaginas are smelling like a bouquet of roses, they're disgusting, they're slimy, they're fishy, which is all, these are all lies.
Right.
And
I'm glad you said that.
we're told that women can't have facial hair, body hair, discoloration, anything, and you know, these are all normal.
Yes, they are.
These are all normal, and it's very interesting because I've just been thinking more about this whole boys think this way and girls think this way, and nobody's been able to offer me an answer that isn't either based on this brain sex theory or based on cultural norms, which are changeable.
Right, right.
Because what's considered to be masculine and feminine in one culture or something in between is completely different in another culture.
Right.
So when we say that we think like a boy, are we talking about within our own Western American culture, or are we talking about some other culture?
I'm thinking, as we know it, our own Western culture.
And I mean, it can happen inside of your brain where you feel like you're genuinely of the opposite sex. And
Reese does.
And this is true, and this does happen. And I don't think it's as common though as we're currently seeing it, especially with girls that are between the ages of 14 to 25. There's a huge scope of girls that are going through this right now, making YouTube videos saying, "Hi, I'm so-and-so, Aiden, Jaden, Caden, and I'm pre-everything. I haven't started hormones yet. I have my appointment with this doctor for hormones soon, and I made an appointment with this doctor to have top surgery and you know, donate to my top surgery fund." And it's getting to be a problem because I don't see this in straight, you know, culture. I see this in queer spaces. I'm seeing more and more, especially female assigned at birth individuals, claiming, I don't identify as a girl and I don't identify as a guy, I'm in between. Or I'm seeing them saying I identify as a guy. I'm also seeing less of a tendency for females to say I'm a lesbian. I'm always seeing gay men and I'm seeing queer women.
Right, okay.
It's never gay men and lesbians, it's always gay men and queer women. And
Interesting.
And that's another thing too, that this whole thing about queer, I find it incredibly erasing. And at the same time, it's sort of exploding because you're saying you're queer, and you're saying like we shouldn't use terms like lesbian and bisexual and things like that, but you can be a demisexual, homoromantic, pangender, otherkin, cat person.
Wow.
No joke, this is actually happening.
Wow. Wow.
You can identify.
I'm learning a lot tonight. So right now, are you happy with where you are? What's going on?
I am. The only thing though is that historically, and even still in current society, women are told to sit down and shut the F up. And to take what's given to them. And I've already been getting rape threats and death threats online. I have a blog on Tumblr where I talk a lot about not just detransitioning, but also...
so for the folks at home, you're going back to a girl.
Yeah.
So you're not happy.
No.
So you're not happy with what's going on now. You're
Exactly.
going back.
Yeah, yeah.
Okay, you're going back.
Yeah, exactly. So like this, the facial hair and stuff, like
Uh-huh.
I'm finding myself being like, okay, how can I deal with this within the context of being a female?
Right.
And I've been noticing it's okay to have these kinds of things, you know, facial hair and things of that sort that happens. And
My Aunt Hazel, sorry Aunt Hazel, she had a beard.
Yeah.
For Christ's sake, she shaved.
yep, yep.
It happens.
Yeah, I have family members that their hair is thinning out. Female family members, like they're getting baldness and stuff. And I think that it's okay, you know, it's okay to look however you exist.
Right. And you exist, going back now, do you exist today as a man or do you exist today as a woman?
As a proud woman.
As a proud woman. What was the moment that you decided, what's going on, this isn't right for me? After all of that, what was the moment that said, I'm going back, this isn't right. This isn't what I want, really.
It was over the course of my transition in general. It was sort of a gradual process, me thinking that, you know, maybe there's something wrong here, because I can't recall the name, but there is a Middle Eastern country that executes homosexuals, but they will pay for transsexual reassignment surgery.
That's right, they're given a year
Yes.
to decide, and they're not happy.
No. And I feel like in our culture, it's definitely not quite as scary as that or as threatening as that, but there is a rift. There's a split between transsexual activists and lesbian and gay activists. There is.
Why can't we work, why can't they work together?
That would make more sense.
Yeah.
Because I see people on both sides of the fence saying, do your research first and figure out if this is a life-changing decision that is right for you.
Right.
So the moment that I figured out that this was not right for me, it wasn't quite one moment, but rather a series of learning and growing as a person.
Right.
But the moment that I decided I didn't want to take this medicine anymore was when I started having, when it was starting to affect my health negatively, and when I was getting tired of having these weird thoughts that happened because of the surge of the hormones.
See, nobody talked about that.
No.
Weird thoughts. Like, do you feel comfortable giving an example?
Yeah, I do. And to preface, I have noticed this going on with other FTMs. They, before treatment, are not as focused on sex, and then during treatment they are. They have a much higher libido and all of that. And I know that there are also people who say, well, yeah, but boys go through that too during puberty. And I'm like, well, yes, but that has to do with the hormones in their bodies. And so to say that we have male and female brains, I don't think that that rings true. It has more to do with the hormone levels in your body and what that does to you, in addition to socialization as either a male or a female. And speaking of, excuse me, the intersex community, definitely they're not happy about the trans movement either.
And why not?
They feel like the transsexuals are sort of co-opting the experiences of intersex people, and that there do exist transsexuals who claim that they have intersex conditions when they do not.
And what does that mean, intersex? This is the first time I've heard it.
Oh, really?
Yeah.
Yeah.
And we're teaching everybody out here. You know, because I'm coming from the place where you love who you want to love, you be who you want to be. Unless it's Batman, then always be Batman, right?
Yeah.
Or Wonder Woman. But this is just surprising. What does intersex mean, and why this black backlash?
Well, when we're born, the doctor decides through the combination of our chromosomes and our primary and secondary sex characteristics, that we are either male or female at birth.
Right. Okay.
However, some children, when they're born, either their chromosomes do not reflect one sex, or their genitals don't reflect a specific sex.
Okay.
And so they are sort of stuck in limbo. And most often than not, doctors will pressure parents to decide what their child should be. So parents will decide to raise either do surgeries or medical treatments to change their child into one sex or another. Or parents will fight back and say, I don't want to change my child. I don't want to make that decision for them.
I'd be that person.
I'm going to let that child grow up and decide how they want to live their life, or if they want to be in between.
Okay.
Now, there are transsexuals who claim that they have intersex conditions when they don't. Not all transsexuals will claim this, but some do.
Okay.
And by doing so, they're sort of pushing aside or eliminating the experiences of people born with intersex conditions.
Okay. Okay. But what's up with the backlash?
Well,
Who cares?
There's backlash all around. But growing up, my parents always told me, there are always going to be people who hate you and don't understand you and want to give you hell no matter what you do.
Right.
So you might as well do what feels the best for you, and also consider how your decisions do have an impact on society, because they're not separate from each other. Nobody lives in a magical bubble where their decisions don't impact those around them.
Right.
But always try to make sure that you're happy inside.
Yeah.
Because there are always going to be haters, essentially.
And you're getting death threats, and I want to know why. Who cares if you go back to a woman?
Yeah.
Who cares?
I've been called a failed man. Yeah.
I don't understand that. Why a failed man?
You
tried something, it's not working out.
I think this person, this was actually a trans woman, so a male to female, who said this to me, and I've been encountering this attitude from male to female transsexuals who claim that they make better women than women.
Well, okay.
And I've been also seeing claims that they would like access to women's only spaces. Whether or not they feel any kind of dysphoria about their genitals, they want access to women's only spaces. Now, this is a touchy subject, and it does get people, in particular feminists, and in particular lesbian feminists, death and rape threats.
Whoa.
Yeah, I think the person that said that I was a failed male had more of a problem with my own politics than my decision to detransition.
Okay.
And there's this sort of tendency from trans people to say, well, you detransitioned, you made a mistake, take personal responsibility for your actions, and don't screw up.
And aren't you? From my end, I would say that you are taking responsibility.
Yes, I am.
And sometimes you can't foresee some effects.
And
you have your textbook things, right? But as you go through it, medicine don't work like this. It's not everybody. It's not for everybody.
And I am perfectly at liberty to provide words of caution to people that are considering this. If I had listened to the number of people, specifically females, that told me to be careful and really, really think about this and please don't do this. If I had not been so headstrong and stubborn about it, I probably would have been a lot healthier today than I am now. I wouldn't have to be dealing with any of this.
So what health effects are you suffering because of this?
It's gotten better.
Okay, good.
It used to be, I was getting heart palpitations for the first time in my life. And I wouldn't be under any stress. I would just be sitting there and I'd start feeling a fluttering in my chest towards my throat going down and radiating back up.
Oh,
and this would go on for about 5 minutes. And there would be nothing to set it off. I wasn't drinking or on any drugs or anything except for the hormones. And my pulse was always elevated, always, even if I was about ready to fall asleep. My girlfriend actually noticed that my pulse was really high. Also, I was doing this thing where I was using a binder, what we call a binder, which is a type of compression vest that you can either pull over your head or some have Velcro that you can snap on. But what it does is it flattens the chest to give you a more male-appearing chest before you undergo surgery.
Right.
Some people mistakenly try to use ace bandages, which aren't good because every time you breathe out, the bandage constricts in further, which creates breathing troubles.
Right.
The binder, though, is just as bad. And again, nobody wants to talk about any of this. And
so we're talking about it today.
We're talking about
You're hearing
it
here, folks. Please listen.
So, corsets. We all know about corsets and how
Oh,
those
girl.
damage the rib cage and can break ribs, deform them.
Yeah.
Compression vests, compression shirts that have a tendency to bunch up here. I noticed that around the same time I was having the high pulse, my girlfriend at night, I would take off my binder after a long day at work, and I would lay down, and one night she just brushed her hand up against my ribs, and I screamed out in agony. I just screamed, and I don't normally scream in pain. And it still, my ribs are still tender right now.
Oh, geez.
And it's
This
just,
is this has raked you over some coals.
Yeah.
And how does your girlfriend deal with this? Did she, through this? Is this a new relationship, or has she been
No.
through this journey with you?
She's been through it with me.
Okay.
She met me about 3 or 4 months while I was starting hormones.
Okay.
She knew, but
And she accepted that you were transitioning into a man.
yes,
And she's accepting now that you're going back into a woman.
yes.
What kind
It's
of
interesting.
conversations do you have?
This is
without
totally
getting too-
interesting. But around the time that I was considering going off of the hormones and returning back to my female status, she was coming to terms with her own sexual orientation and figured out that she is in fact a lesbian.
Okay.
And a lot of this, without getting into, too much personal detail without her consent,
Yeah.
my
right.
transition was causing a lot of pain for her and a lot of sort of post-traumatic stress type things.
Because you were turning into a man, and she's a lesbian. Didn't want a man.
But the thing is, she had never been out as a lesbian before. I was the first person she came out to.
Whoa.
She's been an activist here in Humboldt along with me for the last about 2 years. And she came off, people sort of pushed this label onto her that she was a straight ally, and she kept saying, that she was straight and stuff, and she really wasn't. And I kept similar to how I kept telling myself, I'm not a lesbian, I'm a straight man. And I notice again, a lot of these girls that transition or try to transition, they are completely disgusted by the word lesbian, but they will accept the word queer for their orientation, or straight man.
And what does queer mean for the folks at home? What does that mean?
Anything.
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 Okay.
People who don't have vanilla sex, like people who deviate from missionary style heterosexual sex, are considered queer. The homeless are considered queer. Prostitutes are considered queer.
Really?
Pretty much everything is considered queer that isn't like a small sliver of the percentage of people who are in dominant power, which are, white heterosexual males that are old and rich and Christian.
Wow.
Yeah. So in a way, they're trying to turn this sort of marginalized group into everybody. And I'm like, okay, but that kind of erases the experiences of women of color, of gay men, of bisexuals. You're erasing everybody for this catch-all, like, sort of queer soup.
Right.
Yeah.
Wow. So now the conversations, now you guys are coming to terms as a couple?
Yeah, we've had a very good relationship. We're actually engaged.
Congratulations.
We're not sure if what we're going to do in terms of that. She needs to finish school first, but
Of course.
things are going very well there. We don't fight. We have a very good supportive relationship. We're there for each other.
Good.
And we're just sort of trying to live our own lives without any more pain.
Right.
And it's hard sometimes.
Of
And
course it
we're both also radical lesbian feminists too.
Sweet.
Yeah.
Okay.
And people don't know a lot about that, and that's where a lot of the backlash comes from. Because a lot of FTMs who do detransition are radical feminists. And there's a lot of misunderstandings involved in terms of radical feminism. When people hear the word radical, they think, oh, it's out of this world, it's out there. But it's actually, it has to do with finding the word radical. It means to find the root of the problem, which is
Right.
the patriarchy. So no matter whether you're a woman of color or you're a man of color, you're being oppressed by other men. You're being oppressed by men in general.
Wow.
Yeah, and
Wow.
this causes a lot of problems because we're very misunderstood and we have to do our bidding in secret.
Yeah. Well, I'll have to tell folks at home, that transitioning and detransitioning was even talked about from the Greeks. Tiresias, the blind seer, was a man, then a woman, and then turned back into a man.
Yep.
So it happens, folks.
Mm-hmm.
So if you could talk to somebody out there right now, what would you say to them to give them some support, to give them some help, what to look for?
Well, no matter what you're doing, it's important to do your research, figure out if the negative and positive benefits of hormones are for you. I am available to talk to on Facebook. My name is Heath, HeathAtom, like the atomic bomb. Russell, Russell. You can find me on Facebook. You can also find me on Tumblr. My username there is Nemesis, NYMESES.
Oh, wow. Fantastic. It's been a pleasure to meet you, Heath.
You too.
And ladies and gentlemen, I'd like to continue this conversation. So look us up on Facebook at Out Here in the Redwoods. Talk to us. Talk to Heath. If you have any questions, we'll actually put it forward. And for everyone here at Out Here in the Redwoods, aloha means hello and goodbye. And once again, thank you for coming, and thank you for bringing this wonderful subject to light. Maybe
Thank you
we'll all
too.
get some help and
Yeah.
talk about it.
Thank you.
All right. See you next time, ladies and
Aloha.
gentlemen. Aloha.